My name is Lynn Hall, and I am blessed to manage a medical clinic in West Des Moines, Iowa, called New Leaf Wellness. So every day, I'm able to help patients address their concerns, of which many of them say their main concern is to age healthier. So today, I am delighted to host this webinar, sharing with you how to support your skin and gut, therefore aging healthier. Joining me today are Dr. James Blum and Stephanie Brown. They will address your skin and gut health concerns and explain how you can have a glowing complexion and age beautifully. I know how precious health and wellness is to each of us, and addressing inflammation along with skin issues allows us to age gracefully. Dr. Blum has spent his career involved in research, clinical trials, and direct patient care. He is the CEO of Biotrinetix, and his expertise is in the fields of food, inflammatory markers, and toxin sensitivities. Stephanie Brown practiced in LA for many years as a licensed esthetician before she transitioned to Iowa and worked for 10 years with a plastic surgeon, heading up the laser and skincare department. A year ago, she founded Healthy Skin by Stephanie to have a more intimate relationship with her clients. She not only offers top-of-the-line skincare products and makeup assessments, but she specializes in customizing skincare protocols, offering nationwide support to anyone needing skincare guidance. I want you to have complete understanding of your healthy skin and overall gut wellness. So please jot down any questions that you might have during the webinar, and we will absolutely address them at the end. At this time, I'd like to turn the webinar over to Stephanie.
Thank you, Lynn. I appreciate that nice introduction, and welcome to everybody joining at today's webinar. I'm going to start just by the skin basics and breaking down the skin and what it is and what it does. So we're going to do a little mini skin 101, if you will. The skin is our largest organ, and it has many important functions in the body. It protects us. It regulates our body temperature. So, for example, we will sweat through our pores as a way of naturally cooling ourselves down when we're hot. It's that outer layer. It's that first shield of defense against inflammatories, whether those be external like UV rays, toxic substances, pollution, free radical damage, bacteria, microorganisms, and other infection-causing substances. And if the skin is functioning correctly, it will also protect us from toxins that are created within the body. So its function of secreting those toxic substances, irritants, and damaged cells through our pores is our first vital step in the body's healing process. So in summary, the skin is a major detoxifying organ, and it works in unison or in symphony with other major systems and organs like the liver, the kidneys. And for our discussion today, we're going to specifically be talking about the digestive system and how crucial the digestive system is in maintaining the health and therefore the beauty of the skin. I like to think of the skin as the gateway to our immune system. It's the mirror to our internal health. Our skin is communicating to us all the time if we just stop and look and listen. It's a direct reflection of exactly what is happening in the rest of our body. Whether we come up with a rash or redness or simple discoloration, broken capillaries, acne is a major one. Those are some examples of some external markers that will give us a clue that there is something going on inflammatory within the body. And these organs, the skin and the digestive system, are working in unison together, and they directly affect one another in a major way. Our bodies are complex, and they have an amazing ability to heal itself if we give it the right tools to do so. I like to think of the gut as the nucleus. It's the control center of the entire body. That is where 80% of the overall immune cells reside, and it's the core of everything. It's where we have a balance of a good and bad bacteria, or the microbiome, and those bacteria are responsible for so many important functions in maintaining the health of the body and therefore the skin. And so if we are able to digest food correctly within the gut, then we can assimilate those essential vitamins, minerals, and nutrients that are crucial for maintaining the health and the beauty of the skin. And most of the time, what people are looking at is the exterior. And when they start to see things showing up on the exterior, on their skin, whether it come in the form of lines or wrinkles, discoloration, acne, that's when they start to pay attention and say, there's something going on inside my body. What do I do? Or why is this happening? I can't seem to correct it. And that's when we can look at the interior health to help us to figure out how to directly affect the exterior or the beauty of the skin. So that digestive system is a really crucial part of healthy aging of the skin and the beauty of the exterior of the skin. I'm going to pass it off now to you, Dr. Blum, and you can talk in a little bit more detail about the digestive system and the gut.
Thank you, Stephanie. That was an excellent review of the skin. So today I'll be addressing the relationship between skin, inflammation, and the foods that we eat. The vast majority of skin conditions that we see are acne, dermatitis, psoriasis, eczema, rosacea, gluten face, discoloration, and even myofascial pain syndromes. All these conditions really involve systemic inflammation as opposed to rashes and other allergic reactions that are due to a topical exposure that we occasionally run into. And I wanted to make one thing clear. Not everybody that has a skin condition has a gut condition. The origin of all the skin conditions do occur in the gut, but that doesn't mean that the manifestation involves IBS or other gut-like syndromes. It's just that the gut is the location of where we run into the leaky gut and the origin of the skin conditions. So as Stephanie mentioned, the skin is the chief barrier to toxins. These toxins are dispersed evenly around the globe, covering all corners in our world of the United States. And these toxins are coming from various manufacturing processes, some of which are on the other side of the world. Many of these toxins adversely affect the gut barrier, and that's the connection between the gut and inflammation. So that's really what I want to address. For the purposes of this discussion, we will treat certain foods as toxins, even though that kind of runs against conventional thinking. That is the case in the situation that involves leaky gut. And so what is leaky gut? Leaky gut's a condition in which tiny pores are opened up in the small intestines. And these pores allow tiny pieces of undigested food to migrate from inside the gut channel into the bloodstream. So let's imagine that certain foods are getting through the digestive tract, wind up going into the bloodstream. Well, what happens to our immune system once that happens? Well, most of the immune cells live on the outside of the gut wall for just this purpose. And as soon as bacteria or viral particles or parasites move from inside to outside into the bloodstream, they become activated. And it's their job to run down the food toxins, et cetera, to destroy them, or in the case of the food, to gobble up these tiny little pieces of food. So what happens during that process of phagocytosis and other aspects is that the white blood cells do in fact destroy these tiny food particles, but in doing so, it leaves a trail of free radicals. And what happens when we have a lot of free radicals is they put the free radical antioxidants ratio out of balance. So all of a sudden we're in a situation where we have many more free radicals than we do have antioxidants to counteract that. And one of the effects of having too many free radicals is that the free radicals will attack healthy tissue. And that's the situation that we don't really want. So between the fact that the immune system has revved up to start the process of inflammation, the free radicals destroying healthy tissue, we have a situation that involves systemic inflammation. And that's not a good thing when we're talking about our health. Of course, one of the things that we know that when we have too many free radicals is that we have to counteract it with antioxidants, but we're not in control of when we know that this is happening, and so we don't know when to take antioxidants. So the other piece that happens during inflammation is that the gut biome is affected adversely. We know that there's a relationship between what we consider the good bacteria and the bad bacteria, or for the purposes of health, they're considered bad, but of course they have a role to play. But we get the biome out of control. One of the signals when we have this is that candida or yeast has an overgrowth condition, and we don't want the yeast in overgrowth drive. So what happens during the yeast overgrowth is that it finds an area in the gut wall that's been damaged and sets up shop, creates biofilms to protect itself, and becomes very difficult to dislodge. And we certainly don't want that happening. The other thing to consider is that reactive foods are consumed sometimes 3, 4, sometimes even 5 times a day. So the process of this systemic inflammation is being triggered throughout the day, obviously not during sleep, but you're eating all the time, and if you're eating the wrong foods for you, that inflammation process is going on a daily basis. So the question becomes how to identify which are the reactive foods and what to do about it once you know which foods are active. The simple answer is that you build a elimination diet to reduce the amount of inflammation. So at this point, I want to throw it back to Stephanie, who will explain how she deals with skin conditions, and I'll come back and answer the questions of how to identify and eliminate these foods. Steph?
Great. Thank you, Dr. Blum. Yes, so there are ways that we can look at the exterior of the skin to start giving us deeper clues as to what's going on internally, and particularly with digestion. If we are not digesting our food correctly, then we are creating this inflammation, as Dr. Blum mentioned, and we are absorbing fewer nutrients, vitamins, and minerals that are essential to the health and therefore the beauty of the skin. There is an ancient practice that is used in naturopathic medicine, as well as many estheticians still use it today. I myself do as well. And it's a traditional ancient method called Chinese face mapping. And it's a method of skincare that focuses on zones of the face. such as the forehead, the cheeks, the chin, the nose, and the connections that those zones are believed to have with the internal functions and organ systems. So for example, when I look at someone's skin and I see widespread acne on the forehead and maybe the upper cheeks, that can indicate inflammation in the small intestine, can be caused by this, as Dr. Blum was talking about, this imbalance of the microbiome, the good and bad bacteria in the gut, can point to things like candida overgrowth, yeast, gluten sensitivity. It can also be an overconsumption of citrus and your body's not processing that. It's too acidic. Other examples can be things like dark circles under the eyes. That's a major one when people are concerned about aging, is they look at their eye area and those dark circles. Obviously the skin is aging over time, and that is the thinnest, most delicate tissue in the body, and so it's going to show signs of aging quicker than other parts of the face. But in addition to that, it could be things like compromised kidneys, too much alcohol or sodium consumption. The other major one I see, and it's on the rise, is adult hormonal acne, and it usually appears as cystic, deep acne deep within the skin, those hard, painful lumps on the chin or the lower jawline, kind of the upper neck area. It can be connected to reproductive organs. It can be it's hormonal imbalance, which is in essence caused by digestive imbalance as well. But more importantly, it could be a result of too much dairy consumption. So this Chinese face mapping helps us to kind of zero in on what particular food groups could be a problem for this person's skin, and ways by maybe temporarily, as Dr. Blum talked about, eliminating those or restricting those food groups in the diet for a period of time until we can get the internal health back in balance. We can start to alleviate some of these external symptoms that are bothersome to us, like acne and redness and discoloration. There's many quote-unquote faces of inflammation. And so by looking at the face, again, we oftentimes will overlook the skin in giving us direction at diagnosing disease and inflammation within the body. But again, that skin is really communicating to us all the time. And if we look in the mirror or we see these things, we can start to get a better handle on our overall health of our body. So when I use this practice, I also, in my practice, like to bring my clients in for a full consultation where I can see them, I can look at their skin under a mag lamp. I normally will accompany this with a full signature customized facial for their skin type, because there is not a one-size-fits-all. Everybody's skin is very unique and special to them. And by doing that, I can get a better idea of how I can help them with an external system. And a lot of that has to do with a regimen, what they're using on their skin day and night. Those things are as vital, as important as treating the gut lining. The two techniques together is a recipe for beautiful health and beautifully aging skin, if you will. So I really like to take that first appointment, whether it be in person or over the phone, to really talk to my clients, get an idea of what their concerns are, what their goals are, what things they want to see corrected in their skin or improved, what problems, what symptoms they are having. It's a really great way for me to start, and oftentimes I will use acne as an example again. It's such a major one, and I do believe a lot of it is hormonal and digestive related. And it's really on the rise amongst adults particularly. It's not just a teenage issue, is getting their dietary, getting what they're doing in their dietary choices that could be affecting the acne on their skin. So, and that's when I like to use Dr. Blum's testing, and I will pass it off to you, Dr. Blum, to discuss that aspect because it is so important in just this comprehensive approach to treating the health and beauty of the skin is when we can get a little bit more detail in looking at the gut health, and that's where you come into play.
Again, a nice rendition of what you do. Much appreciated, Stephanie. I own and run a clinical laboratory, and that means that we actually do the testing here at our lab. We specialize in food sensitivity testing, and as Stephanie mentioned, we have a great track record with individuals with various skin conditions. So we identify reactive foods in a gradient manner, and we send the results go back to the ultimately to the patient and to the practitioner. At that time, if the practitioner wants us to, we begin a 3-month consultation period with every patient that tests with us, so that we guide them to identify where those foods are found and how to build a strategy to eat without foods. And sometimes that's not simple. If you're reactive to eggs and wheat and gluten and dairy, that can take quite a bit of time to actualize that particular diet and learn how to eat while not eating their reactive foods. So that's why we provide a consultation with patients and keep in touch with them. I run that section of the lab myself, and I always make sure that the practitioners are on board with exactly the approach that I'm going to use, because every practitioner has different touch points that they want me to either touch upon or stay away from. And so I work with practitioners all the time to make sure that we're on track with what we are consulting about. So again, this is our food sensitivity lab, and if you have questions, we're going to open it up in a little bit. And I'm going to throw it back to Lynn Hall to wind us down now.
Thank you so much, Stephanie and Dr. Blum. I just wanted to say, please stay tuned for future webinars. You can do that by signing up for the newsletter at the address on the screen. We'll be conducting webinars such as the gluten skin webinar, where Stephanie will address the gluten face. Very interesting. And at this time, we'll take questions for Stephanie and Dr. Blum. You can submit them through the chat, or you can reach out to either Dr. Blum and Stephanie using their contact emails that are also on the screen. I do have a couple that have come in as we've been going through the webinar. And the first question is, how can I set up a consult with Stephanie? Stephanie, would you like to address that?
Yes, thank you, Lynn. You can contact me at either the email address that you see, the Stephanie at healthyskinbystephanie.com, or on the phone number listed. And I can set up a time to either meet you in person if you're local in the Des Moines area, or if you're not, I do a lot of phone consults. And we can either FaceTime or Skype, and that's a great way for me to at least see you. Obviously, it's best if I can work on you in person, but if not, I can definitely help steer you in the right direction, whether it comes to product protocol. I like to set up professional protocols, which I forgot to mention earlier, about whether it's facials or peels, whatever we're treating, whatever our goals are in the treatment plan. So please feel free to contact me at the contact information on the screen.
Another question, thank you, Stephanie. Another question I had come in is, how can I get set up as a provider with Dr. Blum's lab? And I'm going to let Dr. Blum address that, but the one thing that I wanted to state before I turn it over to Dr. Blum is there's two ways that he tests, and I'd like Dr. Blum to talk about both of them, including a finger stick, which as Stephanie in her practice uses the finger stick so that she can submit the test to Dr. Blum's lab. Dr. Blum, can you address the question how they get set up as a provider with you?
Sure. Thanks, Lynn. The easiest way to get set up is to call the lab, and we'll talk you through the various logistics and details of how to become a provider and how to do our consultation. Our lab number, general number, is 561-571-2601. So that's 561-571-2601. And anybody here will be able to help you. Thanks,
Thank you, Dr.
Lynn.
Blum. Another question, are either of you utilizing registered dietitians to conduct assessments, provide education, or provide support for clients? Dr. Blum?
Well, in the terms of the consultation with patients, I'm doing it myself. In the past, we've also employed registered nurses to do it, so I'm not using RDs at this time.
Thank you. Another question for the elimination diet plan, how long does that typically take and what happens after that? Dr. Blum?
The process is a 3 or 4 month process. If an individual starts and eliminates everything sort of from the get-go, it's a 90-day process. But as I mentioned before, sometimes people have to phase in to get a handle on the different food groups that they have to eliminate. So we may have to add on a couple of weeks as they get adjusted to what they're doing. So somewhere between 3 and 4 months is our typical process to optimize their health. One has to remember that they didn't get sick overnight, and they're not going to get healthy in, 2 days. It's going to take a little bit of time.
Thank you. So I'm going to do one more question. There was quite a few questions that were submitted, and we can answer those. If you'd email Dr. Blum or Stephanie, we can answer those. Let's see, the very last question is, how could it be that someone very overweight and unhealthy has such beautiful skin? Does this mean they don't have gut health issues? Dr. Blum?
Sure. As I mentioned before, not everybody that has a leaky gut or a compromised gut has gut issues. So, and vice versa. So somebody could be obese, but it hasn't affected their skin. So that's a very common situation where one organ system is affected and not another. So for example, if you think about it, if you take 10 chronic disease individuals, each one of them may have a different organ system involved, but the other organs are perfectly healthy or fairly healthy. So that's why somebody could be having great difficulty with their weight, but have a good-looking skin.
Thank you, Dr. Blum. Again, I'd like to thank everyone for joining us. Their information is listed on the webinar. We'll be emailing out the webinar, and stay tuned for future webinars. Have a great afternoon, everyone.
Thank you, Lynn.